Brothers and sisters, warm greetings from Balaji Vidyapit, popularly referred to as Sbv. I am delighted to meet you all once again through Channel One. I thank you all for your continuous support in this endeavor. Today, I am going to talk about an important day that is observed globally, namely World Mental Health Day and its significance. According to World Health Organization, mental health is defined as integral to well-being, enabling people to realize their full potential, show resilience amidst adversity, be productive across the various settings of daily life, form meaningful relationships, and contribute to their communities. In the light of mental health, it is imperative to talk about the fact as to what mental disorder is all about. A mental disorder is characterized by a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior. Thus, says the World Health Organization. World Mental Health Day, proposed by World Health Organization, observed every year globally on October 10th to raise awareness about mental health and to increase efforts to support those experiencing mental health issues. The theme for this year is Make Mental Health and Well-being for All a Global Priority. The COVID-19 pandemic has created a global crisis that concerns mental health, thereby creating both short and long-term stress, which has presently affected the mental health of millions. Due to COVID-19 pandemic alone, in the year 2020, there was a significant increase in the number of people living with anxiety and depressive disorders. Initial estimates show a 26% to 28% increase in anxiety and major depressive disorders in a matter of just 1 year. Due to this pandemic, mental health services have been severely disrupted and the treatment gap for mental health conditions has widened. Hence, this day provides us an opportunity to reduce stigma and discrimination toward mental health and increase awareness on positive mental health. Let us imagine a world in which mental health is valued, promoted, and protected, where everyone possesses an equal opportunity to enjoy mental health and exercise their human rights, and where everyone can access the mental health care they need.
Welcome you all. I am Dr. Parthiban, Associate Professor at Department of Psychiatry, MGMCRI, Sbv.
Myself, Dr. Rupika Jandyal, Senior Resident, Department of Psychiatry, MGMCRI, Sbv. Before we attempt to talk about the work that we carry out in Sbv, sir, can you tell us about some certain signs and how to recognize a person with mental illness?
Yes, Rupika. So, it can be recognized by any change in a person's behavior, which can be easily noticed by a person who stays close with that individual. It can express like persistent sadness or persistent irritability. It can present like a persistent happiness too, which is not usual for that individual. Sometimes it can present like an irrational fear or worries or excessive anxiety, which might be interfering with an individual's daily routine. You can notice by the form of decreased interactions with his close family members, friends, when compared to their past. Often, they can present like a dramatic change in their biological functions in the form of disturbed sleep or eating habits. Can you add some more points?
Sure, sir. Occasionally, with strange thoughts and perception about self and others, like they may think that someone is trying to harm them, and sometimes people may feel helpless, worthless, and hopeless about their future. Then, importantly, they will express suicidal thoughts or behavior. Rarely, it can manifest with numerous medically unexplained physical symptoms. Sir, can you please tell us about initiatives which we take at our department to promote mental health?
So, one of the major initiative is our Mind Clinic.
Yes, sir.
See, Mind Clinic which we started in the month of April 2020. So, this Mind Clinic is an exclusive helpline number which we provided for a safe channel to express an individual's psychological distress and to receive some professional advice to handle their daily stress and to handle their coping management. And especially during this ongoing pandemic, this service was provided by Department of Psychiatry almost all the days from morning 9 a.m. to 4 p.m. The number for the helpline which was displayed in the screen. Can you shed some more lights on some of the programs which was done by us for the benefit of the students in our Sbv University?
Sure, sir. We conduct a mental health and well-being program for the first year students under the Student Cellulogenesis program. Cellulogenesis means wellness, and this program has been initiated with the aim of identifying such students who needs extra care or attention. The goal is to provide basic awareness about the mental health and stress management and to identify students in need of additional psychological support. That short form is SNAPS. In this context, I wish to highlight we also participate in outreach services. Sir, can you please tell something about it?
See, we participate in many outreach services like health camps, and we also do a mental health screening programs regularly.
Okay, sir, what else?
Every Friday, so we used to collaborate with the urban and the primary health centers, particularly attached to our institutions, in association with other NGOs by providing an outpatient services at Aranganur village, which is close to our campus. Can you mention some more collaborative initiatives which we have done in our department?
Yes, sir, surely. In liaison with the School of Music Therapy Education and Research and the School of Yoga Therapy Education Research, we provide holistic clinical service for the patient with mental illness. Sir, can you please mention some initiative for special population which we have taken at our Department of Psychiatry?
See, we often promote mental health support not only for our patient but also for a special populations like transgender peoples whose mental health is often been ignored by most of us. We started a transgender clinic at our department to support them.
Okay, sir, that's very nice. Can you please mention any programs which were conducted at the community level?
True. So we participate in the Honorable Lieutenant Governor programs in commemoration with the International Day Against Drug Abuse and Illicit Trafficking. Not only this, on the day of World Mental Health Day, our department has organized mental health awareness rally at Rock Beach, Pondicherry recently. And our department, we also in collaboration with the Department of Women and Child Development at the Government of Pondicherry, we conducted multiple school mental health programs in and around Pondicherry.
Okay, sir. Before we conclude, there are some important points regarding mental health which we have to emphasize. It is important to note that mind is a product of brain, human brain.
True. See, mental health disorders are essentially like any medical disorders like a diabetes or hypertension.
Not all mental health problems are mental disorders. A mental health professional can differentiate between the both.
True. So, when someone has a mental health problem, it is important for us to reach them out and offer them a support with a good compassion in the process of recovery.
True, sir, but the most important thing is stigma and ignorance about mental illness are barrier to treatment.
That's true in particularly psychiatry. So we should all join hands in enhancing our mental health literacy, and we also combat with the stigma towards psychiatry, and we need to facilitate some of the help seeking activities for our patients.
Yes, sir. And nowadays, safe and modern treatments methods are available to handle mental health disorders.
True. We should all remember that mental health is an integral part of a human's health.
And as WHO emphasizes that there is no health without mental health.
Definitely. So it is being a pleasure to share with the audience some important aspects of mental health and the works which we have done in the Department of Psychiatry.
Stress is a normal psychological and physical reaction to the demands of life. Everyone reacts differently to different situations, and it is normal to feel stress and worry during a crisis. When our stress level makes us unable to carry out normal responsibilities, it is then time to ask for help. There are some ways to reduce your stress, which include self-care strategies. Self-care strategies are good for your mental and physical health and can help you take charge of your life. To take care of your body, you should be mindful of your physical health by getting enough sleep, regular physical activity, limiting screen time, eating healthy by having a well-balanced diet, and avoiding junk food, tobacco, alcohol, and other harmful drugs. More importantly, you should keep a proper routine in your life. Keep yourself busy, focus on positive thoughts, and be thankful for whatever good you have in your life. Be spiritual in life. Set priorities by setting reasonable goals each day and outline steps you can take to reach those goals. Finally, we should not forget to stay connected to a loved one at this time.
Greetings from Sri Balaji Vidyapeeth. Alumni events enable peers to interact among each other and relive the wonderful memories that they have had at the alma mater. Furthermore, such alumni meets are synonymous with happiness, contentment, pride, and immense gratification, and strengthen the lifetime bonds with their batchmates. Sbv Alumni Meet 2022 was a remarkable success that witnessed a refreshing approach. The alumni belonging to different batches of the constituent teaching units spent a quality day with their peers and teachers. The memorable Alumni Meet 2022 was hosted on September 3rd that culminated in a colorful valedictory function. Professor S.C. Parija, the Honorable Vice Chancellor of Sri Balaji Vidyapeeth, delivered the prestigious Alumni Day address and gave away awards to a few distinguished alumni. Professor P. Karthikeyan, Director of Student and Alumni Affairs SBV, and Mrs. Asha Suresh Babu, General Manager Administration, had made elaborate arrangements to facilitate the smooth conduct of the memorable event. World Pharmacist Day Celebration 2022 was observed with great fervor on the 26th of September 2022. The chief guest was Dr. E. Anandakrishnan, Drug Controller, Department of Drug Control, Government of Puducherry. The keynote address was delivered by Professor S.C. Parija, the Honorable VC of SBV. Professor Shanmuganathan S. Principal, School of Pharmacy, facilitated the event that was received very well among the students and faculty alike. The 5th Annual Intercollegiate Extravaganza, namely Spectra 2022, was hosted by Mahatma Gandhi Medical College and Research Institute, a constituent teaching unit of Sri Balaji Vidyapith, and this was held between October 5th and 8th, year 2022. The events included L&D, fine arts, culturals, and sports. The colorful endeavor got underway with an impressive inauguration that was enabled by Professor S.C. Parija, or Honorable Vice Chancellor of Sri Balaji Vidyapith. Elaborate and impressive arrangements were made by Professor Sitesh Ghosh, the Dean of MGMCRI, and the Vice Principals of MGMCRI, namely Professor S. Padmavati and Professor C.P. Ganesh Babu. Thank you.
Positive mental health is a resource for everyday living and results from individual and community growth. Mental health promotion and positive psychology offers the public an updated way of thinking about their mental health to lessen the stigma associated with mental illness. In general, mental health promotion interventions improve overall well-being, and it has to be delivered in the settings where people live, work, learn, and thrive. These include parental interventions in school and workplace mental health programs, early childhood interventions, and community engagement. Implementing a health promoting public policy like employment opportunities, women empowerment, social support, anti-discrimination programs, strengthening community action involving media, developing personal skills to make them resilient during a stressful period. To maximize impact, mental health promotion activities must be linked closely with mental health services and engage a variety of health and non-health sectors. In the days to arrive, more importance should be given to mental health, it is given to physical health. Salutogenesis, which means focusing on strength and resources, which creates health, should be encouraged and should be included in every university, school, and workplace as it is followed in our university Sbv. I wish you the best of health. Do remember to continue practicing physical distancing, wearing mask, and strictly adhere to hand hygiene. Stay safe. God bless you. Jai Hind.